Angioedema is a localized transient swelling of the subcutaneous tissues and/or the mucosa of the upper respiratory or gastrointestinal tracts. Hereditary angioedema, or HAE, is an autosomal dominant disorder characterized by recurring acute attacks of angioedema affecting the skin, abdomen and upper respiratory tract, including the larynx. Acute angioedema can cause significant morbidity and mortality. In the abdomen, edema of bowel segments or viscera is usually very painful and may be associated with vomiting and diarrhea. Edema of the larynx and upper respiratory tract may obstruct the airway and can be fatal if not addressed promptly. HAE types 1 and 2 occur in individuals with reduced C1 esterase inhibitor activity. Lack of C1 esterase inhibitor protein dysregulates the kallikrein-kinin metabolic cascade, meaning bradykinin-forming enzymes are no longer inhibited and bradykinin is released in excess. It is local increases in bradykinin concentration that lead to angioedema during an HAE attack. Under normal circumstances, the movement of fluid in and out of blood vessels is controlled by a layer of cells, the endothelium, which acts as a semi-permeable barrier. However, during an HAE attack, the barrier function of the endothelium is disrupted by local increases in bradykinin concentration. Bradykinin binds to B2 receptors located on the endothelial cell membranes. Activation of B2 receptors loosens the tight bonds between the endothelial cells, allowing fluid to pass into the surrounding tissue and initiating a swelling attack. FIRAZYR is a specific and selective competitive B2 receptor antagonist. FIRAZYR is a synthetic decapeptide that is structurally similar to natural bradykinin, which is indicated for symptomatic treatment of acute HAE attacks in adults with a C1 esterase inhibitor deficiency. FIRAZYR targets the bradykinin B2 receptor, preventing further activation by endogenous bradykinin, tightening the bonds between the endothelial cells once more, and reducing the movement of fluid into the surrounding tissue. FIRAZYR is administered subcutaneously and starts working in minutes to relieve painful or potentially life-threatening HAE attacks, with first symptom improvement in Phase 3 clinical studies occurring as quickly as 48 minutes after administration in cutaneous and abdominal attacks.